Hello, Jono King here, chiropractor with King Chiropractic. Just a quick video about what I do with the low back. So here I am using flexion distraction just to warm up a patient's back. Sometimes I will use this for radiation into people's legs, and just to warm and to elongate the spine before I adjust someone. And quite commonly chiropractors will use a technique called side posture, where we get someone on the side and we try and get movement into the joints of the low back. And I'll do that coming up very soon. But this flexion distraction is a great way of just warming up the spine and decompressing those discs. So here I am setting someone up for a side posture and about to do the move. Moved quite well, actually. And we'll just see that move again, just so we can see what I'm doing there. I'm basically bringing the joint to tension and putting a little short, quick, precise movement to the joints of the low back. Quite an effective technique for low back pain. And here I'm doing it on the other side, so I'll try and get the leg up quite high to stretch out the low back, and put a little bit of distraction through the joints, particularly around the L5-S1, bringing some of the tissue slack upwards towards the shoulders, and then my line of drive is across and from the inferior to superior portions. A nice little movement there. Here's me doing a little bit of extra massage, trying to get the upper thoracic spine warmed up before I adjust someone. I won't spend too much showing you what I do up here. As I said, this is an attempt to be a short video, but this is all designed to get someone warmed up so I can put a nice little careful movement through the upper back. And you'll see me trying to set someone up here for an adjustment. Trying to get a good little line of drive through the thoracic spine at a particular range of motion and angle. Should be quite comfortable. Nice and easy. And I'm just checking to see if that tension is backed off and to see if that movement has been restored to the thoracic spine. It can be a little bit harder to move the vertebrae of the upper part. So you'll see me here changing hand grip and contact point. Nice. So here I am adjusting a bigger patient. What I mean is, males are generally stronger, larger, and their low backs are more resistant to being adjusted on the side, so I have to be very careful and very precise in my vectors and the forces that I can put through, so I don't hurt my own body or the bodies of my patients. So I'm trying to feel for the joint here, feel for the joint play. You'll notice I like to put the top leg up and then use a straddle technique, so I have my front leg preventing the patient from coming off the table, and this allows a nice and stable feeling. And we put the thrust through. We're just setting up my patient on the other side. He's usually a very hard to adjust patient, so again checking for that joint play.
You okay though?
And trying to put a little movement in.
Okay.
And obviously I wasn't happy with that first force, so I put the second one in. Here's another male patient, also very difficult to adjust, so I thought I'd add this to the video as well, just so you can see how I position a patient and how I set one up. So it's pretty important to note that this shouldn't be too sore for a patient. And if we get all our vectors and line of drive correct, since I'm contacting right on the joint that I want to adjust, it should not be as painful as people think, or possibly as it looks. Once again, I had to put 2 thrusts.
Wonders will never cease, Jared. Keep filming there, Thomas. Lay on the other side there for me. Come around the other side there if we can.
Quite often I do a lot of muscle work in the gluteal regions, specifically the gluteal medius and minimus muscles.
Well, it's good though, at least we've got one.
Pay special attention to the QL muscles, which is above your low back, above those dimples, the side of your spine. If I find a little trigger point there, we'll always use a bit of soft tissue therapy, trigger point therapy, sometimes a bit of acupuncture, just to alleviate those trigger points. And I'll probably do a video in the future showing you how I do that. But I thought today this is the main technique that chiropractors do. It's the most well-known technique, and it seems to be an extremely effective technique for treating low back pain. So in the future, I'm going to try and do a few videos showing you how we treat certain conditions, certain problems, and trying to demystify what chiropractors do. Trying to show you guys what we do at King Chiropractic, myself, Dr. Jono King, and my brother, Dr. Nicholas King. So stay around, stay tuned, and we hope to see you soon.